Although we've experienced 1 year of COVID-19 in Michigan, the fact is, long before the anniversary of the first cases here, there were other anniversaries that led up to Michigan's cases. Let's take a look back.
Tonight, the CDC has confirmed the first case of the 2019 coronavirus in the United States now.
That was January 21st, 3 weeks after it was first described in China and 7 weeks before we would feel it here in Michigan. America was put on notice, and we were still learning. Officials in China have confirmed there is some limited person-to-person spread occurring with this virus. That does raise the concern globally, but the CDC says the risk to the American public remains low at this time. Nonetheless, the next day, physicians were told to be on the lookout. Now, the latest guidance sent to physicians from Michigan's Health Alert Network is that we should ask patients with a fever and lower respiratory illnesses about any recent travel to the Wuhan region of China, or if they have been in close contact with anyone under investigation for this novel coronavirus.
It is concerning.
In the following days, things continue to accelerate. We got some things wrong. Right now, the CDC says face masks are not necessary here in the U.S. And something's right.
As cases of the coronavirus continue to increase around the world, here in Michigan, the response is being stepped up.
Today, the Michigan Department of Health activated its Community Health Emergency Coordination Center. Dr. Frank McGeorge here with an update on this outbreak. Doc?
Yeah, Kim and Devin, this move by the state is an important step to support the response at a state and local level. But we were still underestimating the risk. U.S. public health officials here say the risk to Americans is very low.
Yeah.
It's still all moving in a very concerning direction.
Keep an eye out.
Actually, yeah. All right, Doc.
The World Health Organization even reserved its concern as late as February 4th. The World Health Organization believes the epidemic is mostly centered in China, with only a few outlying clusters in other areas and countries. And they further believe there is no evidence that the virus is mutating or that face masks alone will halt its transmission. It remained unnamed until February 11th, 1 month until landfall in Michigan. Kim and Devin, today the World Health Organization gave the novel coronavirus an official name. It is now COVID-19. They came up with a name that did not refer to a geographic location, an animal, an individual, or a group of people that was also ideally pronounceable. But obviously, that's not stopping the virus. By February 25th, the CDC's tone was reflecting the storm on the horizon. And today, both the CDC and the Secretary of Health and Human Services changed the tone of the message they want Americans to hear.
Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected. The first documented case of community spread was in California. Concern is mounting as the CDC confirms what may be the first U.S. case of community transmission. A person in Northern California who hasn't traveled internationally or had close contact with a known patient. On March 3rd, 2 months into global spread and days before Michigan's first case, we still underestimated the problem. It was most likely already here.
To be clear that the risk here in the United States still remains low despite these new cases.
Absolutely true, Kim and Devin. Overall, yes, the risk is still low, but we do expect to see more cases of community spread. And as more people are tested, the case count will rise. Now, today, our nation's top health experts told senators they are trying to communicate that sense of urgency, but not alarm.
In a large population, most people who get infected will probably have very mild symptoms. Some will have severe illness, pneumonia, and be critically ill. And what's unknown right now is what that full total will be.
Things progressed nationally, and on March 10th, the U.S. map showed Michigan surrounded. Then, just before 11 p.m., after primary election polls closed on March 10th, 2020, the announcement that would change Michiganders' lives happened.
Starts now with a breaking news alert.
Beginning tonight with that breaking news on the coronavirus outbreak, Governor Gretchen Whitmer declaring a state of emergency in Michigan after announcing there are now the 2 first confirmed cases of the virus in our state.
We're taking every step that we can to mitigate the virus spread and keep Michiganders safe. I've signed an executive order declaring a state of emergency in order to maximize our efforts and assist local governments and officials to slow the spread.
Life after that day will live in our memories forever. But seeing how everything evolved, hopefully we'll see the signs faster if the world ever faces a threat like this again. Back to you.